Good morning, Alex. My name is Nav. I'm a faculty member at ATSU. And how are you doing this morning?
I'm doing great. Nice to meet you, Nav.
Well, so let's just start off with tell me a little bit about yourself.
Yeah, thank you. So I am a first generation college student. My mom became pregnant in high school, and my dad dropped out early to join the military to support his young family. So that makes me a military dependent as well. The military moved us about every 2 years, and this exposed me to a wide variety of people of different backgrounds. And this has made me into the culturally humble person I am today. I went to UC Santa Barbara and got my undergraduate degree in chemistry, and I'm currently pursuing a master's of biomedical sciences through AT Still. I got my foot into the door of healthcare during the beginning of the COVID-19 pandemic because I felt a calling. I felt a calling to address the burnout and the personnel shortage that I noticed was happening in my local area. It's been about 5 years now, and I've had experiences both as a medical assistant and a pharmacy technician. I've engaged in patient education and assisted in procedures such as biopsies and Mohs surgery, and I've really enjoyed the hands-on aspect of the patient-facing care. I feel one of my better qualities is my empathy, and I feel like I really make the patients feel comfortable in the office. While I have enjoyed my supportive role, I want to do more. I want to become a clinician and make those medical decisions. I have worked with many great PAs over the past few years, and ultimately I've decided to pursue a career as a PA.
Well, thank you for telling me about yourself and letting me know about how you got into medicine. So just to build on that question, why do you want to be a PA?
Yeah, thank you. So growing up, as I mentioned, I was a military dependent, and I saw firsthand the how difficult it can be to access healthcare, especially in the more rural areas that we were stationed. For example, my mom needed surgery at one time, and we had to travel over an hour because there were no specialists in the area. Another time, I ended up in the ER because the local PCP was booking months out, and my condition spiraled. It's experiences like these that have shown me the importance of having access to healthcare. And I've also seen how dedicated providers can make such an impact. So it's my experiences that even drew me to healthcare in the first place when I saw the need during COVID. Ultimately, I want to become a PA because it is encompassing everything that I'm passionate about: medicine, patient care, teamwork, adaptability, and to be a lifelong learner.
So if you couldn't go to PA school, what would you do?
If you were to ask my peers to describe me, I feel like they would say I have perseverance and a strong work ethic. If I were not to get into this round, into PA school this round, I would continue accumulating patient-facing hours and volunteer experiences, and I would continue applying. There is no plan B. In fact, I am a reapplicant. And to improve my academic prowess this application cycle and to better prepare me for PA school, I'm currently pursuing a Master's of Biomedical Sciences. This has been a rigorous program, but I feel like it's really helped me solidify the foundational medical skills and science knowledge that I need for PA school. It has fine-tuned my time management skills and improved on my critical thinking skills. I'm happy to say that I've received all A's so far in the program, and we are more than halfway through.
So talking about your experiences, can you describe a clinical experience you've had?
Yes, I would love to do that. One of my most memorable patient experiences has probably to do with an older gentleman. He was diagnosed with a large skin cancer on his temple, and at the time I was lead medical assistant and first assist for our Mohs surgeon. I became acquainted with this patient over many weeks during the biopsy and our on-phone surgical consultations, pre-op surgery, and then post-op visits themselves as well. Our encounter started off as a professional relationship, but soon bloomed into a friendship. He shared with me his life stories, and we shared a bond over our love for the ocean. He was a little worried about the turnaround time for the procedure because he had planned a very special cruise ship trip with his aging wife. And due to the complexities of his surgery, we couldn't quite guarantee if he would be able to go on the trip or not. Fortunately, he healed up just fine and shortly thereafter was able to go on his cruise trip. About a month passed and he spontaneously showed up at the office one day without an appointment and he wanted to give me something. I was handed a folder, and in the folder were images of the trip and a pamphlet about the cruise and a handwritten note thanking me for making him feel at such ease during his treatment. This was a very impactful moment for me because it showed me that compassion has such a large impact on patient outcomes. And I realized that my role as a medical assistant wasn't just to support the surgeon, but also to support the patient in a stressful, hard time so that they can get back to the things that they love. I was filled with gratitude at this patient's kind gesture, and I will remember our friendship going forward.
Well, that's really wonderful to hear. So do you prefer the title physician assistant or physician associate, and why?
That's a great question. In the history that I've read on the name change itself, the originally PAs were named physician associates. Somewhere in about the 80s or 90s, it changed to physician assistant. And now, about 30, 40 years later, we are back to changing it back to physician associate. So ultimately, I feel whatever the consensus is doesn't affect how I will practice on a day-to-day. I believe back in 2021 there was a vote saying that the name change was going to be confirmed back to physician associate, and so I'll support that decision. I do feel it will take a few years for all the paperwork to catch up, and in that time, if I am referred to as a physician assistant or physician associate, that will not bother me, and I will go on with my day and continue to provide quality care.
Absolutely. So how would you define the term professionalism?
The term professionalism. So, I view professionalism as the foundation of trust within the healthcare system. For me, I see professionalism touching almost all aspects of medicine and extends to all interactions with providers and patients, colleagues, healthcare organizations. So, without trust, patient care will suffer, teamwork will break down, and the integrity of the system I feel will be at stake. So, to me, professionalism is built on maintaining that trust, and this is done through competence and respect and medical ethical decision making and accountability.
That's very good to hear. So just going a little bit unorthodox, what is the last book you read?
The last book I read actually was is called The House of God, and it is by Samuel Shem, and it is actually a book about medicine, but it is a fictional satirical novel. It focuses on a group of first-year medical interns in the 1970s, and they work at a hospital that they refer to as the House of God. There are themes of grit and determination, but the book also shows that approaching life with a little bit of humor goes a long way.
Awesome. So back to the healthcare, what is your opinion on what's the biggest issue or barrier we face in medicine today?
I am glad you asked this question. I believe one of the biggest challenges in healthcare today is the chronic provider shortage. This leads to long wait times and poor patient outcomes. And one of my main goals as a PA is to expand access to care, especially to underserved communities. I feel like I want to be a part of the solution in bridging these gaps in care. I want to provide patients with timely, high quality, evidence-based treatments. I feel I can accomplish this by pursuing jobs in the primary care sector and also advocating for policies that support primary care expansion. And eventually, I do plan on mentoring pre-PA students in a few years once I'm a few years into practice. I see PAs as the cornerstone in alleviating the primary and the provider shortage.
Well, it's been great listening to your answers. Do you have any questions for me?
Questions for you. I do have a few questions for you. What are the three most important qualities that you look for in your applicants?
I believe the qualities we look for is someone who is focused on a patient-focused care, someone who has built their application not only educationally, but through clinical experience, through volunteering, and has a desire to impact not only their community, but the profession in its generality. And we want someone who is, going into medicine for the right reasons. There's a lot of fa issues we face in healthcare, and the PA profession is growing, and we want our students to grow with that profession.
Great, thank you so much. I do have one more.
Okay, yeah, no, absolutely.
How does the school meet its mission to expand access to care to medically underserved communities?
So here at ATSU, we have a few programs in which we do outreach programs to rural areas, either within our own city or nearby cities. And so we take students to these areas, and we provide any type of relief, and if that's clinical care, if that's just having an outreach for the community in some way. So we try to bring our students to various areas, not only to give them experience, but also to give back to all of our communities around us, and not just the one city that we're in.
Thank
So,
you.
Alex, it was great listening to you, and I appreciate you giving your time to me today.
Nav, it's been such a pleasure, and I thank you for your time.
Thank you. Bye bye.